You have two temporal bones, one on either side of the cranial base between the greater wings of the sphenoid bone and the occipital bone. They form a large part of the middle cranial fossa and a small portion of the posterior cranial fossa. They got a lot of features that we have to consider. Some are internal, some are external. So you have a squamous portion. A squamous portion, again, is just a flat portion. Tympanic portion is the portion that contains the organs of hearing. You've got a styloid process. A styloid process, if you recall, is just a pointy projection. You got a zygomatic process, and a zygomatic process forms a portion of your cheek. Now, that's not to be confused with zygomatic bone. Zygomatic bone is a bone that is kind of on the lateral anterior portion of your face. So when you're considering your cheek as being the portion just below and maybe to the outside of your eyes, that would be your zygomatic bone. So that prominence that is kind of out front on the lateral side of your face is your zygomatic bone, and it attaches to your maxilla medially. But what you've got is a ridge of bone that extends anteriorly from your temporal bone to meet up with your zygomatic bone, and that is what we call the zygomatic process of the temporal bone. And we'll take a look at that here in a minute. You have a petromastoid portion, and that's that thick, dense ridge of bone right behind your ear, and that's where, again, your organs of hearing and equilibrium live. So if you find your ear, the auricle of your ear, just kind of put your hands behind that, and you'll find that real dense ridge of bone, and it comes down to not really a point, but maybe an apex at the bottom, and that would be your mastoid portion. So it is also a sinus. Your mastoids also contain sinuses, much like your ethmoids do, in that they are individual small air cells, and there can be dozens of them. So they can also, since they're a sinus, they can also get like a sinus infection type thing in there. We don't call it a sinus infection, we call it mastoiditis. And a mastoiditis, if a patient gets mastoiditis, then it affects their equilibrium and they have a hard time standing up. I've seen patients, actually co-workers with mastoiditis, that they couldn't even sit up with the bed, or the world would spin so violently that they would throw up. So for days on end, they would have to lay flat until they actually got that little sinus infection and their mastoids resolved. So these things we just talked about. You have the squamous portion, which is the thin portion, it's the upper portion. You got the zygomatic process that forms and it extends from the temporal bone forward to meet up with the zygomatic bone or the zygoma to create the full face cheek on the lateral side. And you got the articular tubercle. You're never going to be asked about that, but you do have a mandibular fossa, and that is what receives the upper portion of the mandible, and you can actually feel where that is as well. If you put your hands on either side of your face, right behind your ear, and you open your mouth, open and close your mouth, you can actually feel where the mandible rotates around inside that mandibular fossa. So it's not really a ball and socket joint, it's a hinge joint, but the mandibular fossa is the portion on the temporal bone that is half of that articulation, the other half being the condyle of the mandible itself, and we'll talk about that later in the semester. Tympanic portion we talked about. The styloid process we took a look at, and we'll take a look at again. The mastoid portion we talked about has a lot of air cells. The mastoid process itself is that cone-shaped thing that I was having you feel behind your ears. And then on the inside, we've got the petrous portion. And again, we talked about the different names for the petrous portion. You got petrous portion, petrous pyramids, pars petrosa, petrous ridges. They all mean the same thing. They're conical, pyramidal in shape, and they are the densest and thickest portion of the bones of the cranium. And as such, they're very prominent on the x-rays, and we're going to use them to evaluate how well we're positioned. You got 3 bones inside the Peters pyramids, inside the tympanic portion of the temporal bone, and those are your bones of hearing, and they are the malleus, the incus, and the stapes. The temporal bone articulates with the parietal bone, the occipital bone, the sphenoid bone, the zygoma with the zygomatic process, and it also articulates with the mandible at that hinge joint that I was talking about before. So this is what it looks like. Squamous portion up here. That's your mastoid process. That's the styloid process, that little point right there. Your EAM is here. Your mastoid portion is there. That would be your zygomatic process, and then you've got your mandibular fossa is this thing right there. So the mandible kind of plugs into right there. For positioning, we have to consider a lot of different things. We have to consider skull topography, which we have not talked about yet. We'll need to consider skull morphology, and that is that general shape of the head. We need to consider general body position and direction of the central ray if the particular procedure we're taking involves angulation of the central ray. Certainly cleanliness, and we'll talk about that here in a bit, and then radiation protection as well. So topography, the things that you need to know and the points that you need to know are the glabella. When we talked about the glabella, the inner canthus, which is where the eyelids come together right beside the bridge of the nose. The outer canthus, which is exactly the opposite, is the edge of the eye on the outside. The nasion we talked about. The infraorbital margin is just the bottom of the eye socket. The acanthion we talked about, and that's the bottom of the nose attachment. The gonion, which is the angle of the mandible on the back side. The mental point is the peak of the chin, the external auditory meatus or external acoustic meatus, that's the ear hole. The auricle point would be the top of the ear itself, and then top of the ear attachment. And these two really are probably a little bit overstated here. We just don't use them a whole lot. So looking at it, what we've got is glabella, nasion, acanthion, mental point straight down the front. And then we've got the outer canthus here and here. We've got the inner canthus here and here. We've got the infraorbital margin, and then we've got the angle of the mandible, which is the gonion. And I think that was pretty much it. Oh yeah, we've got obviously mid-sagittal plane, but we've also got another line that we haven't discussed yet, and that would be the interpupillary line. So a line going right between the pupils would be your interpupillary line. So radiographic landmarks, we've got the orbital meatal line, and that will be a line that goes from the outer canthus, it's an imaginary line, goes from the outer canthus to the external auditory meatus. A infraorbital meatal line would go from the infraorbital margin right below the eye out to the EAM, and the glabellomeatal line would go from the glabella, so above the nasion, out to the EAM. Interpupillary line we just talked about. It's a line that goes right between the pupils. A acanthomeatal line would be from the acanthion to the EAM, and a mentomeatal line, or a MML, would go from the point of the chin all the way out to the EAM.